International Committee of the Red Cross is trying to work at national level, and we are well aware that the country is facing a tremendous challenge with this new COVID crisis at national level. That's why we have also stepped up our support to the Bangladesh Red Crescent societies. We provided them a grant at the beginning of the crisis so that they can provide disinfection to hospitals throughout the country, so that they can also provide food parcels in all districts of the countries. We are also providing them support so that their volunteers and staff can keep operating as frontliner. So our partnership with the BDRCS, the Bangladesh Red Crescent, is essential. We've been also in very close contact with the Ministry of Home Affairs and more specifically its Prison Directorate. As you know, ICRC is in normal time visiting prisons of the Ministry of Home Affairs. Those days we had to adapt our support to prison with a strong focus again on COVID prevention by providing hygienic equipment, disinfection material, thermometers, and all sorts of support to the Prison Directorate so that we can prevent or mitigate as much as we can risks of infection in prison. It's a cooperation that is ongoing and that will of course continue in close coordination with the government. Also in the same kind of partnership with the government of Bangladesh, we have been closely working with the Ministry of Health and the Ministry of Disaster Management and Response in the field of the management of the dead. Unfortunately, the COVID crisis showed us everywhere in the world that we may have a significant increase of people that will die because of the virus. So we have to get ready for that with very clear protocol on how to manage the dead bodies, but how also to ensure dignified burial of these people, and with the necessary Islamic ritual and the necessary protection for the people who are going to take care of that. Today I am visiting the camp of displaced people from Rakhine in Konarpara. It's a camp that the ICRC has been assisting now since more than 2 years. You can see behind me a medical mobile team we are organizing for the displaced people who are settled in this very specific camp, which is at the border between Bangladesh and Myanmar, and that has not been integrated into the main camps in Cox's Bazar. That's why the ICRC is specifically involved in this area. For these displaced people, we also provide on a monthly basis some food support, some hygienic material, the basic necessity, in fact, so that these people can live in dignity. And because of the COVID-19 epidemics that is now starting in Bangladesh, we also had to adapt, and we installed some hand washing points at different areas of the camps. We made also a lot of information and communication with the community so that they can be informed, and we can ensure that they wash their hands, ensure social distancing, and we take the necessary precautionary measures. Now, beyond this camp, the International Committee of the Red Cross, from its office in Cox's Bazar, is also involved in the relief programs at the district level, with at the moment a very strong focus on medical facilities. We are increasing our support to the Sadr hospital in Cox's Bazar with putting in place a new emergency department that will be specific for patients with COVID-19. We are also stepping up our support to health complexes in Ukiah, in Teknaf, in Ramu. And in addition to that, we are continuing supporting a number of primary healthcare centers, either mobile like this one or fixed in different areas of the district. All this work in health facilities is a combination of medical work with some medical expertise, but also engineering and water construction, so that the infrastructure of the health facilities are supported. It goes also together with a very strong preoccupation on economic security for the people in the camp here, of course, with food distribution. But beyond this camp, we also have in mind the situation in other areas of Bangladesh. I'm thinking about the Chittagong Hill Tracts, where the ICRC is going to organize 3 sets of distribution in the 3 districts of the Chittagong Hill Tracts in the coming days to address the needs of people that have been deeply impacted by the holidays and shutdown of activities, and their incomes have drastically decreased. So we want to address that as an emergency response to this COVID situation. So to conclude, I just would like to say that we are here today in Kanarpaha, but the ICRC is also well aware that needs are going far beyond this area, far beyond Cox's Bazar district, and we are side by side with the authorities in Bangladesh to give the support we can at the national level. Thank you very much.